Whew. Hey there. We all know the environmental and ethical reasons for following a plant-based diet, but what happens inside our bodies as we swap out animal proteins for more plant-based ones? I'm Adam KRUGER, and you may know me as the PlantX Vegalier, but I'm also a lifelong athlete. Join me as I speak with different members of the medical advisory board here at PlantX to figure out exactly what goes on inside your body as you follow a more plant-based diet. Welcome to Medically Speaking. On this episode, I have Dr. Ed Tam, a hepatologist here in Vancouver, discussing how to combat non-alcoholic fatty liver disease with a plant-based diet. Fascinating conversation. Check it out.
I'm Dr. Ed Tam. I'm a hepatologist or liver specialist here in Vancouver, BC.
Dr. Tam, thank you so much for being here today.
Thanks for having me. It's my pleasure.
It's so nice to always talk to the professionals because, you know, as someone who is definitely plant-based, has been for a really long time, and I've seen a whole bunch of benefits in my own personal diet, even though I'm very much not a preachy kind of like, hey, everyone has to do this sort of person, but, you know, when you find these benefits, you want people to know about them, right? It's nice to discuss it with a professional so that, you know, people can understand what's going on inside the body. And as you know, with PlantX, it's not about going 100% vegan or you can't join. It's all about incremental change, bringing yourself to the table, so to speak, and incorporating more plants into your diet. So I want to discuss, in a previous episode, we talked about your thoughts on plant-based living and eating. I want to talk now specifically about your specialty, which is the liver. And I believe you mentioned in a past episode or in the episode that we spoke that the number one issue right now is non-alcoholic fatty liver disease. So can we start with what the liver does, and then let's discuss what this condition is and how it's brought about and how we can fix it. Obviously, I'll ask more questions as we go along the way, but let's start with what the liver does.
Yeah, the liver, of course, I'm biased, but the liver is a super important organ. It has hundreds of different functions, but it really, it metabolizes all the nutrients, substances that we might bring into our body, the toxins, medications. It has a role in synthesizing important proteins in the blood, such as those that are responsible for blood clotting, so protein synthesis. It has a hand in certainly metabolism of all sorts, energy storage. It really just does so many different things. And the fact is we're dependent on it. But at the same time, it's a very kind of silent and resilient organ, and from a liver function perspective, we don't really get into difficulties with liver function until liver disease is very advanced. So in many ways, it's kind of a silent organ. It just goes about its business until or unless there's significant concerns that develop over time. Yeah.
Interesting. And you say that it goes about its business until significant issues come over time. And I want to talk about how we can create these issues, or more specifically, how we avoid them. But what does create them?
Yeah, there's many different causes of liver disease out there, but perhaps the one that we're seeing the most these days is called non-alcoholic fatty liver disease. It's actually the most common cause of liver disease in Canada and North America. And in Canada, in fact, it's actually 25% of adults in Canada. So the condition of non-alcoholic fatty liver disease is a rising epidemic. It's a condition where fat infiltrates the cells of the liver, and if left unchecked, that can lead to inflammation and then scar tissue or fibrosis over time, and eventually liver cirrhosis and liver failure. So we're seeing this rising epidemic. We're unfortunately seeing a broad spectrum of the disease. I see a lot of people with mild disease from non-alcoholic fatty liver disease. Unfortunately, we see it as the number one rising reason for need of liver transplant as well. So it's a very important condition, and prevention and treatment, obviously very, very key in trying to really stave the long-term concerns related to it.
So now my question then becomes, well, how does a plant-based diet really change the course of non-alcoholic fatty liver disease, or does it have any effect at all?
Yeah, it's a great question. Obviously, when we think about medical treatment for any condition, liver or otherwise, most people, they think, well, what medication am I going to take to fix this condition? That's probably the number one question I get when I'm seeing somebody with non-alcoholic fatty liver disease. It was a medication that's going to fix this condition. And the fact is, it's probably the area of liver research that is the most active right now, but still we don't have any therapies on the market to specifically treat non-alcoholic fatty liver disease. But what we do have is a lot of evidence bases to help us understand that lifestyle modification really is effective at treating it and really is the mainstay of therapy. And even in the future, when we got medications that work for non-alcoholic fatty liver disease, lifestyle modification is still going to be important. So I often get asked, well, what is really the dietary guidance, from an evidence-based perspective that's going to help, a person treat or prevent non-alcoholic fatty liver disease? And I think if you look to the literature, number one, the diet out there that seems to have the most data behind it is a Mediterranean-focused diet. Now, a Mediterranean diet is not vegan by nature, but it certainly is plant-focused and heavily plant-based, of course. So a diet, high in fresh vegetables, legumes, those types of things. That in the case of a Mediterranean diet still may have components that are not plant-based. Certainly, there's a lot of evidence behind it. Over and above that, we think about being careful about refined carbohydrates, added sugar. And so while those things themselves can be plant-based, there's also a balance, as well. So I think from my perspective, plant-based eating can most certainly be healthy, but there are aspects of it that may not be healthy. You have to be careful as well. Just as people ask me, well, can a gluten-free diet be healthy? Absolutely. It could be not healthy as well. It kind of depends on how you decide to eat within it,
Well, right. I mean, you see a bunch of people who go vegan and all they're eating is like pasta and right. Watermelon or whatever. And it's like, well, look, no, you need to have some actual, right. Proper
some
food.
balance there.
Exactly. It's got to be like Whole Foods, right? So
yes.
At the end of the day.
So I think that's an important aspect of it. And I think that it's helpful. I think there's a lot of different ways that you can eat healthy from a liver perspective, most certainly. And I think a plant-based diet most certainly is a very healthy way to eat, but it's not the only way. I think in general, though, I'm always encouraging people to bring more plants into their diet, because I think whether you are, vegan or whether you're eating omnivore, eating more plant-focused makes sense to me.
I mean, I think that's wise advice. And again, that's totally in alignment with everything that we're doing here at PlantX, which is, hey, look, if you're vegan, great. If you're questioning it, great. If you don't even know what the word means or how to pronounce it, fine. Yeah. Come in and check us out. Come and try some food. Just bring in more plants into your diet, because as we've seen, whether you're going completely vegan or just adding more plants in, you're still getting benefits from bringing in more plants. So with all that being said, what are your thoughts on like meatless Mondays?
I think it's a great idea. I think that any strategy just to kind of make some incremental change makes sense to me, and a lot of times, sometimes I'll see people or I'll be talking to patients about their non-alcoholic fatty liver disease, and they want some very specific advice for what they can incorporate into their lifestyle to make that kind of change. And I think that, something like Meatless Mondays, or, even just specifically talking, well, what is a good breakfast choice, that you could make that, that you could switch from having bacon and eggs every morning, just something tangible. I think a lot of times patients don't know where to start. And I think that it can be overwhelming thinking about making, 50 different changes, after a conversation. But instead, doing something simple, whether it's Meatless Mondays or, just something very, tangible and attainable. It makes sense, and I think can lead to sustainable and meaningful change over time. Yeah.
I couldn't agree more with that. And it's interesting. I don't mean to be salesy in any way, but I mean, for those of you who don't know where to start, go to plantx.com. You can order ready-made meals that are amazing, delicious, nutritious. They're created by board-certified nutritionists. There you go. And you can get your nutrients that way, macro and micro. Again, I'm going to step off the preachy soapbox here. I personally order from them all the time, and I love it. So just kind of gonna throw that out there. I have one more question for you, which is kind of an odd one, but I read somewhere once that with liver transplants, you're not actually transplanting the whole liver, but you can actually take a portion of it, and then once that's transplanted into the new patient, it actually grows into a full-size liver. Is that true?
Yeah, it's true. It's true. Liver transplant's a pretty amazing intervention, and of course, when we talk about prevention and treatment, what we're really trying to do is to avoid the need for liver transplant. But as I've mentioned, in the past, for example, when you think of non-alcoholic fatty liver disease, liver transplantation sometimes is necessary, and most certainly is a rising indication for that. And so when you're talking about living donor transplant, where you take a portion of liver, and obviously donate it to somebody. It's quite amazing, what happens in the donor and in the recipient to see that organ grow to a full size, over the course of really a matter of weeks. It's quite amazing.
So basically the liver is the Wolverine of our body.
It is, that one solid organ that can regenerate, and it's very resilient, so, and that's the thing, in my clinical practice, most of the time when I'm seeing individuals, I tell them they have a liver condition, they will say, well, I feel fine, and it's true. Most people are asymptomatic at most stages of liver disease until it becomes very advanced. So a lot of what we talk about is, early diagnosis, figuring it out, and doing things from a preventative nature to make sure you don't get into a situation where your liver function is compromised.
Oh, that's interesting. So what would you recommend then for people who are just going about their everyday lives? Like who's most at risk, and who would you recommend, hey, look, you should go see someone and make sure that you're screened regularly? Is this something that your doctor will normally be able to see through regular blood tests, or is it something that you have to kind of delve into more deeply?
It's a really tricky question because, if you look at what is recommended for the periodic health exam, say in Canada, we don't suggest in general that everybody gets a check of liver enzymes or liver function, so a lot of times it's a really fair question, who do you have to be worried about? If you're going to attack and talk about that number one cause of liver disease, as I mentioned, non-alcoholic fatty liver disease, I think the two things that come to mind are individuals who carry extra weight. So it definitely is a condition that's linked to the obesity epidemic. And so carrying extra weight is a strong risk factor. Diabetes is an extremely strong risk factor for the condition as well. So if you've got diabetes or borderline diabetes, if you look at data sets, you may have about a 70% chance of having non-alcoholic fatty liver disease as well. And so those are scenarios that I think are to be mindful of and can be significantly impacted upon with positive lifestyle change. That's to be sure.
Wow. Okay. So then it would stand to reason, just based on, and again, this is me finding, just links, whether they're causal or not, but if it's linked to obesity, right, and a more plant-based diet is linked to actually less obesity, then it would stand to reason that is a helpful preventer of non-alcoholic fatty liver disease. Just in and of itself, you're helping to eliminate one risk factor if you're able to stay in shape.
Of course, I think that's absolutely makes sense. And of course, from my perspective, as a liver specialist, I'm seeing people after they have the disease, after they have the condition, right? But what we really want to do is to talk about preventative measures. So the earlier you start eating more healthy, and I do think a more plant-based diet is certainly a part of that, the more likely you are to, I think, prevent this condition. And hopefully, we'll see things start to improve as I think there's more of an emphasis around how we can be eating more healthy.
That's amazing advice. Dr. Tam, once again, thank you for being on the show today. This is just amazing to hear. At the end of the day, like we always say, you don't have to go full vegan, although, by all means do it. But you don't have to. Just incorporate more plants into your diet. Try to be as healthy as you can. That way you can stay as healthy as you can be for the rest of your life. Thanks again for being with us today.
It was my pleasure. Thanks for having me.
Well, I hope you learned something new here today, because I sure did. If you have any questions, just put them in the comments below, and we'll address them in a future episode. Until then, stay fit, stay healthy, and eat more plants. See you next time.